Welcome back to my channel. If you are a medical student, MBBS graduate, or a doctor already practicing and you are thinking about moving to Canada, then this video is for you. Today, I will explain how an international medical graduate or immigrant can move to Canada and become a doctor there. I will explain all pathways step by step. It is very simple, and I hope we will get some perspective into this by the end of the video. So first point, Canada does not have a single pathway for immigrants to be practicing there. The process could be long, competitive, expensive, and also time consuming, but the main thing to focus on is that it is possible. And many doctors are already practicing there in Canada. So, pathway 1 is the traditional pathway. That is, first you get your PR, then you give the exams, and then you get the residency. This is also the most common pathway and also the one which is having the more maximum success rate. So in that, step 1 is that you have to complete your medical degree in your respective country, and your medical degree should be recognized by WHO. You can check if the medical college that you are currently studying in is recognized or not by finding it in the list provided by World Directory of Medical Schools, where you'll have to filter out your country, city, and then find your uh, medical school in that WHO list directory of medical schools. If you have made sure that your medical school does uh, participate in this WHO directory, then you are well eligible for further steps in this process. Second is that your medical degree must be verified by Medical Council of Canada, MCC. This is done by the website called physiciansapply.ca. Physiciansapply.ca will have a fee of somewhere around $300 that you will have to pay, and then you'll have to upload your degrees and certificates such as MBBS degree, internship certificate, and postgraduate certificate or degree if you have one, and get them all verified. This step is mandatory, a little bit expensive, and there is no shortcut. You'll have to do this in order to start your pathway. Step 3 is that after doing the verification, you will have to pass two exams. First is MCCQE Part 1, which is a computer based exam and it tests basic medical knowledge. It is similar to USMLE Step 1 and Step 2 CK. Then second is the NAC exam, which is a one-day clinical exam, tests patient interaction and clinical skills. It is similar to USMLE Step 2 CS. Yes, it can be stressful and difficult, but this is the requirement. After completing your exams, it's time to apply for your Canadian PR. This can also be done from your home country using pathways such as Express Entry or PNP, namely Provincial Nominee Programs. You must have a PR in order to apply residency in most provinces. After you get your PR, and you will apply for residency using CARMS. So you will apply to residency through Canadian Resident Matching Service. This matching is very competitive, especially for immigrants, because they do have limited seats that are designated for immigrants. After you complete your training, then you get your training license, and after residency, and you will get the Royal College certification. After you complete your residency, which is fairly straightforward, it would not be an obstacle in your pathway, because you have already completed the most difficult part, that is matching. Everything is pretty straightforward. After that, it will fall into place one by one. You do not have to worry about that process as of now. So then you will get a full license and then you can work as a consultant. You can work in a hospital, clinic, or open your private practice, whatever. This pathway works, but it is long and difficult. Coming to pathway number two, that is, you find a job first, and then you get a PR, and then you get a residency. This is the pathway that I personally suggest for most immigrants. Instead of coming to Canada directly as a PR and then find a job, you can find a job in another sectors which is paid, and in sectors like healthcare, research, or any skilled role which is eligible for Canadian experience class. Examples are research assistant, clinic coordinator, healthcare analyst, any hospital related role. Why is this pathway better? Because you will be already living in Canada, you understand the healthcare system, you make professional connections, you can do hospital volunteering. Canadian doctors can write letters of recommendations as they will supervise your work. All of this dramatically increases your chances of matching. You will still need to verify your degree, write MCCQE1 exam and NEC exam, apply through CARMS, apply for PR during or after working. This pathway does make life a little easier in the long run, but one thing to remember is that when you are working in Canada, at that time you will not be able to focus 100% on studies, because living in Canada could be expensive and you will have to do a paid job in addition to your volunteering. And so that this please remember this factor while doing preparation. If possible, already complete the reading part, the theory exams in your country, and then move to Canada with a healthcare job. Pathway number 3 is Atlantic Immigration Program. This is a very powerful and underrated option. This program focuses in these provinces, that is the Atlantic provinces, which are near the Atlantic Ocean, namely New Brunswick, Newfoundland and Labrador, Prince Edward Island, and Nova Scotia. How does this help immigrants? So you can apply for jobs in these provinces, then settle there, get a faster PR, focus your residency application in these provinces, because you are already living there, already working there, already well connected. Your residency application becomes much stronger automatically. Coming to pathway number 4, postgraduate training, fellowships, and then in Canadian PR. This pathway is for immigrants who already started or completed PG training in their home country. So if you're already in a PG training, please complete that first. Be an outstanding candidate during entire residency. Do research, publish papers, do volunteering work, and then apply for a clinical fellowship in Canada. Once you come to Canada as a clinical fellow, you have two options. First is to repeat residency, apply through CARMS, use Canadian experience and recommendation, match more easily than fresh immigrants. Option 2 is alternate pathway, that is, you do not need to repeat your residency. Some immigrants get certified through alternate pathways, do not need to repeat residency, work directly as consultants. This depends on specialty, province, and your credentials. I have seen a few immigrants succeed through this pathway as well, provided that they had a very strong profile and were already experienced and practicing in their clinical fields. It is a must mention about Quebec that if you are good at French, then Quebec is an excellent option. French language skills can significantly improve your chances to get PR even if you are not a doctor. If you learn French, then the pathways open automatically in Canada. The final message that I would like to give all of you is that first is the traditional PR followed by residency. Second option is to find a job first in healthcare. third is focus on Atlantic immigration programs, and fourth is that go for a clinical fellowship. They all look very similar and confusing, but this is how your approach makes all the difference. I hope you like this video. Please like, share,